Every night we go to the infectious disease experts in Boston for insight into the coronavirus pandemic. And we're joined tonight by Dr. Daniel Koriskis. He is chief of the Division of Infectious Diseases at Brigham and Women's Hospital. Thanks for being with us again. We appreciate it. So today the U.S. surpassed 3 million confirmed COVID-19 cases. It took us 3 months to log the first million, but it only took us 26 days to log the last million. So what do you see in that trend?
That is a really disturbing trend, Emily. It's nice to talk to you again this evening. What we're seeing is the exponential rise of the number of cases of COVID-19 across the country, where we're getting faster and faster accumulation of cases. And it really tells us that in parts of the country outside of Massachusetts and New York, the epidemic is really out of control.
So then what do we do now, here in Massachusetts, beyond our state, to try to get things back under control?
Well, I think there are two things. It's a bit like watching a forest fire rage across the road and you're, spraying the trees near you to make sure that the fire doesn't leap across. We want to be sure in Massachusetts that we continue with all the measures that we have in place to prevent the reintroduction of COVID-19 into our community and to prevent its spread. And in the rest of the country, what we really need is leadership that tells people just how important it is to be wearing masks, to be avoiding situations of crowding that allow the spread of the virus, and to shut down those activities that can't take place without a mask where the virus is spreading so easily.
So when we talk about that leadership, there is a lot of debate, especially today, about the reopening of schools in the fall. In New York City, 75% of parents there said they want their kids physically in the school. So what's the risk if states do decide to just send the kids back, and what do we need to think about?
I think the risk is going to vary quite a lot state by state. First of all, there's enormous value in having children in school. They learn not only subject matter, but they have social learning. Many children rely on schools for nutrition. So there's real value in having students in school, and many parents rely on schools to look after their kids during the day so that they can work. But it's one thing to think about sending children back to school in a place like New York or in Massachusetts, where we have the epidemic under control. It's quite a different thing to be thinking about doing that in Houston or in Los Angeles or in Phoenix, Arizona, where the epidemic is raging out of control.
Really has to be tailored to a case-by-case basis. Okay. Dr. Koriskis, thank you so much. We really appreciate your time.
My pleasure. Thank you.